Yes, the reason we're talking about this new report, all children in the UK should be taken to see the dentist before their first birthday. That is the message of a new campaign aimed at improving the dental health of youngsters.
Let's see what they found out. The British Society of Paediatric Dentistry says it's hoping to reach families early so it can provide support on prevention. Now, just 3% of babies were taken to the dentist before their first birthday in the year to March. 80% of children aged between 1 and 2 hadn't visited an NHS dentist in the past year. And a quarter of 5-year-olds in England have tooth decay.
Joined now by Sarah Hurley, who's Chief Dental Officer for England, and dentist Claire Stevens. Very good morning to you.
Morning.
And people noticed we have in front of us here, you brought in a few little items for us, including a jar of teeth. And these are teeth that have been removed from... Who can explain this for us?
So this is an afternoon's work for me, sadly. In that jar contains over 60 teeth, some of those extracted from children as young as 2. There's 16 teeth I extracted from 1 2-year-old child.
16?
Yes.
16 baby teeth.
How many did that leave?
It didn't leave any. He didn't have any other teeth. He has 4 yet to come in.
People immediately will be sort of reeling from that. Why did 16 teeth have to be removed from one child's mouth?
Because of decay that was present in there, so basic messages that the family had not been aware of, continued bottle use past the first birthday, taking milk to bed at night, not brushing twice daily with a fluoride toothpaste, key prevention messages. And that child had only first access to dentist because he was in pain. This is why this is important. It's absolutely vital. We need to reach children as soon as they're having teeth come through. Parents should be encouraged to take their child to the dentist for a checkup, and certainly by their first birthday. Dental check by 1.
Sarah Hurley, you're the Chief Dental Officer for England. Why do you think this message isn't getting through then?
I think there's a lot on parents' plates early on in their child's life. Lots of messages being thrown by different agencies, but not necessarily when it comes to teeth, the same message by all those agencies. So we want to work with general practitioners, health visitors, nursing staff, all those that are seeing children on a regular basis to make sure those consistent messages are going through. Please bring your child. The doors are open to see your child for a dental check by 1.
What's the most conflicting message?
I think people just misunderstand this idea of baby teeth don't matter. Well, baby teeth do matter. And they are going to be a great start in life for a smile for life.
Do you want to explain that one? So that's one of the myths, that baby teeth don't matter. So the thought process there is you're going to lose the teeth anyway, so why does it matter if they're not in very good condition? Just talk us through that one. Because
decayed teeth still have the potential to cause pain, swelling, infections, sleepless nights, time off school.
But do they affect the next set of teeth?
Well, they can do. If they're left there and untreated, then you can get structural problems with the adult teeth that come, and early loss can cause problems in terms of spacing, so more likely to need braces treatment later on.
On a practical note, we've done stories before about access to dentists. And maybe people are using it as an excuse, or maybe not. But people maybe think, you know, I tried to go to the dentist and they said there's a big waiting list. And, you know, what's the rules on this? You've got a young child. Do you have a right of access to a dentist? What's the deal?
NHS England has a statutory obligation to provide care based on need, and in local areas we're asking them to look at what the exact need is, but more importantly, where we've identified areas where there are access issues, we are working actively with committees.
That is a problem, is it? So people trying to do the right thing, and lo and behold, you go to the dentist, we can't see you. You ask around, you can't find anywhere. So
there are 2 things that we've done. Claire has challenged the dental profession to see 4 additional children by the age of 1. So, you know, guys, there is an opportunity for you. We're working with local commissioners, local authorities, and I'm saying there are 13 key areas where we know that access is difficult, and there is a programme about to start that is going to enable that. It started in Manchester, it was announced last Wednesday, one of the key areas to improve access and awareness for children to be brought in to start that oral health journey early.
Briefly, Claire, the first visit, it doesn't actually have to involve much, does it?
Absolutely not. You know, parents shouldn't be worried that their child might misbehave or not manage an examination. What we're trying to encourage here is a positive, lifelong relationship with dentistry. That dentist may talk about weaning. We're here to support. We brought a selection of cups, so to start introducing an open top or a free flow cup, one that when you turn it upside down, it comes out. You don't require to suck to get the fluid out. We start introducing those at 6 months to stop the bottle by a year, start start trying to give key prevention messages using the fluoride toothpaste and keeping down those sweet treats.
Don't they believe in the tooth fairy anymore? Why did they let you take all those teeth?
Unfortunately, it's a very saddening part of my job, but the way that I see it is I'm relieving those children of pain, and I'm then supporting the families to make sure that they're not back to see me again to have more teeth
It's
out.
an important message, but I will very happily give you those teeth back to take away with you.
Thank you for inviting me today.
Claire Stevens, thank you very much. Sarah Hurley, thank you very much.
7:46.